the No More Heart Disease, like these books that have come out and the information on nitric oxide and citrulline and L-arginine and everything is so fascinating that it is the best kept secret, I think. I mean, the discovery of nitric oxide won the Nobel Prize in Medicine in 1998, and it's I think it's way harder to win the Nobel Prize in Medicine than it is the Nobel Prize, what seems like they give out like candy sometimes, you know? So it's it's a tough one. But Ford, when you on your front page of your website, you talk about how you uncover these hidden heart health secrets, and how have you been able to kind of skirt the line of being in the medical field and not being completely silenced while you're uncovering these things for people?
I do get some active and aggressive pushback, but the reality of the situation is much more an issue of uh, just benign neglect. And what I mean by that is, if you look at the way insurance is set up, it brings a lot of advantages. You know, people are able to get health care that in many cases they could otherwise not afford. But the but insurance brings with it a lot of problems. One of the problems is that uh, if the most effective thing is education, then how does insurance pay for a doctor or the doctor's staff to educate a patient? They don't. They can't. That's the problem. So, because insurance can't say, I don't know whether you've effectively educated this patient or not, they just give up on that. And what they do pay the doctor for is writing a script, because that's something objective. They've seen evidence that the prescription was written, or doing a surgery, placing a stent. You know, all of those things are things that are, quote, objective, and therefore you can and should pay for. The things that really matter, teaching, as I discussed in the very beginning, still, if somebody wants to hear it or not, they need to hear it. And so that's one of the major challenges that I have. I've got YouTube finding an audience for me that's interested in the topic, but I also have to work on making it interesting. In an insurance environment, there's no place for any of that. It's all, what will the insurance company pay for? And they will not pay for any kind of education. They will pay for prescriptions. They will pay for procedures. And so that's what you get in the standard medical arena. I'm fortunate because of my training at Hopkins in preventive medicine. You know, I started off working as an ER doc in the emergency department because it was a great place to just park for a couple of years to figure out what I wanted to do. How was I going to get into prevention? Because you just didn't get paid for
Right.
it. I was in the ER. I remember I was in the ER and I was seeing my umpteenth 50-something-year-old man with a heart attack. And it's like, you know, in our world, one of the major things, if there was one thing I could change, it would be the expectation that we get into our 60s and we could have a heart attack. And that's just the way reality is. That's not the way reality needs to be. We don't have to be able, we don't have to get used to the idea. That's not reality, that you get into your 60s and you have a heart attack
Yeah.
or you're at risk for it. But it's still, despite all of my ranting and raving from the hilltop, most people still think that's the case.